Hello students, here I am with my next video. Previously we have seen the cervical vertebra as well as thoracic vertebra. Now today we are going to see the lumbar vertebra. Okay, so as every vertebra, it also has body and vertebral arch along with this vertebral foramen. Okay, in between body and vertebral arch there is a vertebral foramen. So see, what is the peculiarity of lumbar vertebra? The lumbar vertebra you can easily recognize by its large shape body, and it is bean shape or kidney shape. Okay, so bean shape or kidney shape body and short and strong spine. The spine is short and strong. Okay, so they are 5 in number, and all are typical except fifth lumbar vertebra, it is atypical. Okay, so and the costal facets are absent on the transverse process. There are no costal facets. Again, there is no foramina transverse area in the transverse process. So you have to recognize the lumbar vertebra due to large body and bean shaped body. Okay, and absence of costal facets on body as well as transverse processes, and there is no foramina transverse area. Okay, now the features are like this. Body is large as compared with the remaining structure. It is large and bean shape or kidney shape body. See, the anterior surface or this surface is greater as compared with the posterior, and which contributes to form the anteroposterior curvature, that is the lordosis. Okay, then the superior surface is flat, and inferior surface, it is articulate with the corresponding superior surface of the lumbar vertebra, and the inferior surface of fifth lumbar vertebra, it get articulate with this sacrum and forms the lumbosacral joint like this way. Okay, superiorly it forms the intervertebral joint, and inferiorly it forms the lumbosacral joint. So body is large, bean shape. Anterior surface is large as compared with the posterior surface. It forms the curvature that is called as the lumbar lordosis. Normally it is present, and when it gets straightened, then it causes the pain. Okay, then the anteroposterior diameter, this is the anteroposterior diameter, it is less as compared with the side to side transverse diameter. Okay, now the pedicles are strong, and they are directed posteriorly backwards. Both the pedicles, these are the pedicles, they are directed backwards, and they show the superiorly there is a superior vertebral notch and inferior vertebral notch. This is the inferior vertebral notch. This is the inferior vertebral notch, and this is the superior vertebral notch, and they form intervertebral foramen like this. See, now if you can see, this is the intervertebral foramen. Okay, so pedicles are directed backwards, and in between these superior articular facets and body, there is a superior vertebral notch which is shallow as compared with the inferior vertebral notch which is deep. This is the deep. Now the laminas are directed backward and on its backward and medially. Okay, here these are the pedicles and these are the lamina. Both are the laminas. They are the short and thick, and they unite posteriorly to form the spine. The spine is short. The spine is very short, and it is like quadrilateral plate, and the posterior and inferior and posterior border is thickened. The posterior and inferior border of spine is thickened. It is like a quadrilateral plate. Okay. Now see the transverse processes, they are directed laterally and backwards. They are directed laterally and backwards, and they are homologous with the costal element, and inferiorly, the inferior surface of transverse process, it is somehow thicker at its medial end, and it gives the accessory process. Okay. The superior articular facets, these are the superior articular facets, and these are the inferior articular facets. So the distance between superior articular facet is as compared with the large as compared with the inferior articular facets. The distance between inferior articular facets, you can see like this. Both are the inferior articular facets and superior articular facets. The distance here, it looks the more as compared with this distance. Okay, the direction of superior articular facets, they are directed medially and backward. See, means here you can see clearly, here are the superior articular facets. See, you can see this. Okay, and they are concave. Superior articular facet, they are directed medially and backward, and they are concave. Now the inferior articular facets are directed laterally and forwards, and they are slightly convex as compared with the superior articular facets. Okay. So this is all about the lumbar vertebra. Only the fifth lumbar vertebra is atypical, because the spine of that fifth lumbar vertebra is again thick, large, and the distance between this superior and inferior articular facets is equal or more in the case of inferior articular facets. That is the difference. Okay, only remaining features are the same. So this is the lumbar vertebra. You see the body is bean shaped, the spine is short, quadrilateral plate like, the posterior and inferior border are thick of the spine. The articular facet, superior articular facet, they are directed medially and backward, and the inferior articular facets, they are directed laterally and forwards. They are convex. The pedicles are directed backwards and straight, thick, short, and lamina, they are directed backwards, but on medial sides they unites to form the spine, to give the spine. The vertebral foramen, it is a triangular in shape, and as compared with the thoracic vertebra, it is large, but as compared with the cervical vertebra, the vertebral foramen is small. Okay, this is the vertebral foramen, and the foramen formed by this vertebral notch is intervertebral foramen.